Welcome. Today we are going to walk through everything you need to know about iron deficiency anemia. In this video, we will go over the causes of iron deficiency anemia. Let's start. The first thing to understand about iron deficiency anemia is that, in adults, it is almost never primarily a dietary problem. The dominant driver is chronic blood loss. And when we talk about chronic blood loss, there are two sources that account for the vast majority of cases. The first is abnormally heavy menstrual bleeding, and the second is bleeding from gastrointestinal lesions. In developed countries, the gastrointestinal lesion most commonly responsible is carcinoma of the colon. In less developed parts of the world, hookworm disease takes that role. This is an important distinction to keep in mind because the underlying cause shapes both the workup and the treatment strategy. Now, dietary deficiency is worth discussing separately because it does matter, just in a more specific population. In adults, it is a rare cause. But in infants, it becomes clinically very important, and the reason is biological. Human breast milk is naturally low in iron. A newborn arrives with a set of iron stores accumulated during fetal development, but those stores are finite and become depleted within the first 6 months of life. If iron is not introduced through dietary supplementation or iron-rich foods at that point, the infant will head into deficiency. Premature infants are at even greater risk because they are born before those fetal iron stores have fully accumulated, so their reserves are smaller to begin with. Another group at similar risk is infants fed cow's milk instead of breast milk or formula because cow's milk is a poor source of bioavailable iron and can actually interfere with iron absorption. One group that is often overlooked in this conversation is elderly individuals. The text specifically notes that dietary iron deficiency can occasionally occur in older persons, though it remains rare. The tendency in clinical practice is to assume that an adult with iron deficiency must be bleeding somewhere. And while that assumption is usually correct, it should not cause us to completely ignore the nutritional angle in elderly patients who may have reduced dietary variety or impaired absorption. The third major cause is increased iron requirement, a situation where the body simply needs more iron than it is currently getting, even if intake is technically normal. This occurs during pregnancy where the developing fetus draws heavily and continuously on the mother's iron stores. The fetal demand can deplete maternal reserves even in women who were not iron deficient before conception. The same principles applies to infants and preadolescents who are in rapid growth phases and may outgrow borderline iron stores that were adequate before the growth spurt began.